When you feel a sneeze or a cough coming, try to prevent sneezing or coughing into your hands, as this will contaminate your hands and spread germs. Covering your mouth prevents the spread of germs. You probably knew that, but the way you cover up also matters. And that means breaking a habit you've done all your life. Cover your mouth and nose with flexed elbow or a tissue, not your hands. Discard the used tissue in an appropriate bin immediately. Then, wash your hands with soap and running water to help stop the spread of germs. Turn on water. Wet hands. Apply soap and lather up. Focus on washing your hands for at least 20 seconds. Wash the front of your hands, the back, between fingers and around the nails. Rinse hands under running water. Use something clean to wipe your hands, preferably a disposable paper towel. The best way to wash your hands is using running water and soap, but sometimes we don't have that available. When not
is on.
They've gone back to standby. It's up now, but problems, AJ? The sign language lady is not. Is she coming?
I have to take her out. Remember, she normally be in on the side.
Oh. Yeah. You took her out?
Is on.
A pleasant afternoon and welcome to our NEOC COVID-19 weekly briefing for Wednesday, November 3rd, 2021. I am Lesroy Williams. Thank you very much for joining us for our briefing today as we continue to inform you on what is happening with the management of the COVID-19 pandemic here in the Federation of St. Kitts and Nevis. We have had our highs and we have had our lows, and that seems to be the trend all over the world. It goes up and it comes down, but what we do know is that the pandemic is not over. The pandemic is still with us, and we still have to be cautious, and we still have to follow all of the health protocols that have been implemented for our own security and safety and that of those in our communities. So we want to thank you for being with us today, because you are an important stakeholder in the management of the COVID-19 pandemic. Today, I want to invite, firstly, to address us, he'll give us a presentation, our Medical Chief of Staff at the Joseph N. France General Hospital, Dr. Cameron Wilkinson.
Thank you, Lesroy. Good afternoon. This week, I wrote a piece on social media called "The Joys of Success and the Perils of Complacency." We were recently recognized by the Pan American Health Organization for a successful vaccination program thus far. Our new infections and hospitalization rates are down significantly, and our vaccination coverage is climbing as we continue what most would agree is a successful fight against COVID-19 thus far. We now have 77.2% of adults with at least one shot and 72.9% fully vaccinated, and the vaccination rate among our teenagers is climbing. However, this low case count and high vaccination coverage can become a breeding ground for complacency if we are not mindful. The sad occurrence of 2 more COVID deaths over the last few days should be a wake-up call and a warning to us that we are still in the middle of a pandemic and there is a deadly virus that is still circulating in our communities. The deaths continue to be among those who are unvaccinated. 23 of the 25 deaths did not have the protection that was available to them through vaccination. Sadly, we will be back here to report more deaths if persons remain unprotected. Despite the clear evidence that the vaccine protects against severe disease, hospitalization, and deaths, there is still a segment of the population that has no defensive shield against the virus because they remain unvaccinated. Getting vaccinated is not just a personal choice. Like wearing a mask, it is a personal responsibility you should and must assume in this public health crisis, because your decision not to get vaccinated has far-reaching consequences for us all. By becoming vaccinated, you are less likely to become infected, less likely to transmit the virus to others, and less likely to become severely ill. And you and your contacts are less likely to be hospitalized and overwhelm the healthcare system. More importantly, the first life you can save through vaccination is your own. Remember, it takes only an amber to start a forest fire. It takes only a single case of COVID-19 to spark a new wave of infection that can threaten our health system and push us back into increased curfews and even lockdowns. The experience of others elsewhere should be a warning to us here. Earlier this year, countries like Australia, China, Singapore, and Taiwan had high vaccination coverages, and their cases were under control. Still, in each of these countries, new outbreaks emerged as restrictions were relaxed, forcing them to re-implement restrictive measures and increase vigilance. As we slowly emerge from this third wave, many are beginning to become complacent and less vigilant with the use of the non-pharmaceuticals, wearing masks, washing and hand sanitizing, and social distance. Even as many are demanding the return to mass gatherings and contact sporting events as if the pandemic is over. While we enjoy the gains made as we attempt to rid ourselves of the stranglehold that COVID-19 has on our lives, we must not succumb to the perils of complacency. Therefore, I urge you to continue to be vigilant and not get complacent, as complacency and inaction is just as dangerous as the virus, and it gives the virus an opportunity to thrive. The vaccine is our best protection, and the higher the population coverage, the more normalcy we can achieve. We can get back to in-person learning in all of our schools. We can have a return of all sporting events and entertainment and other extracurricular activities that were put on hold due to the pandemic if we are all protected from this deadly virus through vaccination. So continue to use the non-pharmaceuticals and go out and get vaccinated if your desire is for us to move back to a sense of normalcy. Thank you.
Thank you, Dr. Wilkinson. I now invite our Superintendent of Police, Mr. Cromwell Williams, to bring us the Mr. Cromwell Henry. I got that mixed up. Cromwell Williams is another person. And he will bring us the update on the new regulations.
Thank you, Mr. Williams, and a pleasant good afternoon to all. I know you mentioned that I would bring you an update on the new regulations, but I just want to advise that the old regulation is still in effect and it will expire on Thursday the 4th, 5 a.m. on Thursday the 4th. However, new regulations have been published, but they will not be in effect until tomorrow. Suffice it to say, there has been no significant changes in these new regulations, and so we continue to be guided by all the protocols that we have become accustomed to. To get into my presentation, I will begin. We are encouraged by the low number of daily new COVID-19 infections, and again, we want to thank you for your actions that have led or that have brought us to this downward trend, that has brought about this downward trend in new cases. All of our gains can be easily destroyed, however, if we become complacent and ignore the protocols and other measures that have kept us safe this far. The COVID-19 Prevention and Control Act and all its provisions are still in effect. We know that the virus is spread through close person-to-person contact, hence the need for adherence to physical and social distancing protocols. Consequently, we continue to focus our attention on bars and other social activities. Regulation 10.5 of the Emergency Powers Regulation outlines the protocols for bars, and these are: 1. All persons shall adhere to the social and physical distancing protocols. That is, persons must have a distance of 6 feet between them. All persons shall adhere to the hygiene protocols. This requires regular sanitization of high-touch surfaces and your hands. The spacing between tables shall allow for a minimum of 6 feet between persons. And all persons, including staff, shall wear a face mask covering their nose and mouth, except when eating or drinking. These protocols will also apply to any social activity outside the bar setting. As always, I want to remind us that we should always wear a face mask when in public, avoid crowd and crowded places, practice good hygiene and sanitization behavior, and if possible, get vaccinated. Thank you.
Thank you very much, Superintendent Henry. I now invite our Chief Medical Officer, Dr. Hazel Laws, to bring us the update on the Health Emergency Operations Committee situation report as of today.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone. As per usual, it's my task to share with you the Health Emergency Operating Committee Situation Report for today, Wednesday, November the 3rd, 2021. The COVID-19 pandemic continues to impact us globally, regionally, and locally. In terms of what's happening or its impact on the Federation, it has impacted our health system, it has impacted our domestic economy, and it has impacted social life as we know it. In terms of its effect on the health system, the pandemic has caused us to experience 3 waves of infection. Now, the 3rd wave began around about mid-August, so that's about 2.5 months now, and we've been trying to contain this wave of infections, and we have been successful. It's now under control. And this, we have objective evidence of this because we look at and we monitor the 7-day incidence rate, and at present that rate is down to 84.7 per 100,000 of the population, and this is coming from 260 per 100,000 about 3 weeks ago. Now, within the past week, last Wednesday to yesterday, Tuesday, November the 2nd, we've added 40 new COVID-19 cases to our tally. Now, this is 17 cases less than we counted the previous week. In terms of hospitalizations, only 2 new hospital admissions within this past 1 week period. We have had 6 patients being discharged, and the number of recoveries continue to increase with 194 recoveries within this past week. In terms of the deaths, we've counted 4 additional COVID-19 related deaths during this past week. In the previous week, we had 0. This past week, we've added 4 new COVID-19 related deaths. So this slide just provides us a snapshot as to our COVID-19 status on the ground currently. So as a federation, we've reported a total of 2,686 COVID-19 related cases, 434 cases reported for Nevis, 2,252 cases reported SENKITs. The number of recoveries, as I said before, continue to increase. We've counted 2,536 so far, so that leaves 125 active cases. We are very happy about this because this is the lowest number of active cases in a number of weeks. And ladies and gentlemen, we really want to keep it like this, or we even want the number of active cases to be lower than this. In terms of the active cases, 30 of these cases are being followed up in Nevis, and 95 of these cases are being monitored by the team of case managers on SENKITs. In terms of hospitalizations, currently 3 COVID-19 cases are admitted at the JNF General Hospital on the COVID ward. As we said before, to date, the Federation has reported 25 COVID-19 related deaths. So as I said, this provides you a quick summary of the COVID-19 status currently in the Federation. Now, we monitor the data with respect to the COVID-19 related deaths. As we said, 22 of the 25 died on SENKITs, 3 of the 25 on Nevis. 84% of these deaths were individuals who were unvaccinated, and you could see majority of them were 60 within over 60 age band. In other words, when you look at this data, what is this really saying to us? What this is saying is that if you are unvaccinated, if you are over 60, and I will add if you have multiple health conditions, you are at risk for one, picking up COVID, and secondly, your risk of death related to COVID is increased with these predisposing factors. So we want you to focus on this, meaning I'm speaking to those who have not yet come on board in terms of accepting the vaccine. Look at the evidence, and this is local evidence. Be informed, empower yourself to make that right decision. Now, we also monitor the data regarding those who are diagnosed with COVID-19. So when you look at the vaccination status of those diagnosed with COVID-19, 68% of these individuals are not vaccinated. Only quarter, 24.3% fully vaccinated, and 8% partially vaccinated, meaning just having one dose on board. So again, if you are unvaccinated at present in the Federation, your risk of picking up COVID is increased. Now this is the latest style as at the end of workday today. So far, 24,513 individuals are fully vaccinated, having received 2 doses of the COVID-19 vaccine. 77.2% of adults in our population have received the first dose, and the coverage rate in terms of fully vaccinated adults, 72.9%. In terms of children 12 to 17 years, 12.4% of the children within this age band have come on board and received 1 dose, and 9.2% have come on board in terms of receiving 2 doses or being fully vaccinated, having received 2 doses of the Pfizer-BioNTech vaccine. So in terms of our vaccination status, when you look at the total number of adults, children fully vaccinated, the percentage of the total population fully vaccinated equals 52%. So 52% of our total population fully vaccinated, and this includes adults, children 12 to 17 years. So St. Kitts and Nevis has achieved and surpassed the WHO threshold of having at least 40% of our total population fully vaccinated. And so this is an achievement, and we continue to maintain this momentum in terms of vaccinating our population. We have been acknowledged by the Pan American Health Organization in passing this benchmark by their penning an article that has global reach, and we've provided you the link to this article. Now, ladies and gentlemen, based on the latest report coming out of the Caribbean Public Health Agency, we now know that all 4 variants of concern of the SARS-CoV-2 virus are present in the region. So just as a reminder, you have variants of concern and variants of interest. So the variants of concern, the variants that are more virulent, more contagious, and the variants of interest have impacted us. For example, the Lambda variant. So the Alpha variant was first identified in the United Kingdom. Beta, first identified in South Africa. The Gamma variant in Brazil. The Delta variant, yes, the Delta variant, we all hear about the Delta. It was first identified in India. And so all these variants are present in the Caribbean region. So even though in St. Kitts and Nevis we have the 3rd wave under control, our numbers are going down, the risk of exposure to the virus, the risk of importing any of these variants is still significant. And so we have to not let our guard down. We need to be vigilant and continue the COVID-19 prevention, public health, and social measures. This slide was sent to us from CAFA. This just highlights the distribution of the variants. So in the Caribbean region, you have the Delta variant in circulation. So they look at all the samples they receive for genomic sequencing, and 43% Gamma variant, 29% Delta, 18% Alpha, and 3% Lambda. St. Kitts and Nevis falls into that 3% because based on the evidence we have, that's the variant that is in circulation for now in our federation. So we have to be very vigilant and continue our public health and social measures in terms of reducing our risk of exposure to the virus. So I just wanted to add some, provide you some additional information regarding long COVID. As I said last week, there are a number, so to date we have 2,686 persons impacted by COVID. We've had 2,536 individuals recovering. Now, of these 2,536 individuals, some are still complaining of the long-term consequences of COVID-19, or what is now deemed long COVID syndrome. So these individuals, some have, shared with me one-on-one, they complain of fatigue, a post-COVID fatigue, a tiredness. So some persons have gone out to work, and then by mid-afternoon they really have to stop because that fatigue, that malaise is compelling them to go back home. Shortness of breath, chest pain, we hear of a brain fog. So in other words, their cognitive function isn't as it was before. Sleep abnormalities, and some individuals still experience changes in terms of their sense of smell and taste. But most importantly, this slide just shows that the long COVID syndrome seems to affect multiple organ systems. So it affects your lungs, shortness of breath, chest pain, a nagging cough that is persistent. It affects your gastrointestinal system, your pancreas, your spleen, your liver, your kidneys. And so this whole COVID is real. And it's a bit complicated. So even after recovery, you have symptoms affecting or involving multiple organs. But I found this information interesting, and this is coming out of the British Medical Journal, and it really, is trying to figure out who is at risk for long COVID. And I found this interesting. Based on the study they did, individuals who are older, so persons who are over 50, who have been diagnosed with COVID, and those with pre-existing medical conditions or comorbidities. So the greater the number of medical conditions you have, the greater your risk of long COVID, or recovering and still have long-term, experience long-term effects of COVID. And of interest is the type of pre-existing medical condition. So if you have hypertension, if you are obese, if you have a psychiatric condition or an immunosuppressed medical condition, your risk of experiencing symptoms, COVID-like symptoms after recovery is increased. And so this is interesting. And so again, I would use this plug to say individuals that falls in this category. And if you have pre-existing medical conditions, hypertension, obesity, psychiatric illness, and you have not yet come on board in terms of receiving the vaccine, it will protect you from getting COVID, and it would reduce your risk of experiencing long COVID even after recovery. All right, so the management, again, long COVID is new. COVID as a disease entity is new. And so the long-term effects the scientists are just gathering this data. And so they're just getting a handle in terms of the investigation of long COVID, diagnosis, and the management protocols for long COVID. This is just good news. Just wanted to underscore that the United States Food and Drug Administration and the United States Centers for Disease and Control approved the Pfizer-BioNTech vaccine for emergency use in children aged 5 to 11 years. Now, the dose they get is a third of the dose given to the older children, 12 to 17, and adults. Now, and this is important and this is good news. So what you have is that in the US, the children are already lining up for the Pfizer vaccine, meaning children 5 to 11 years. And the reason for this is that in countries that are experiencing the Delta variant outbreaks as a result of the Delta variant has significantly affected children in this age band, and it has caused an increase in hospitalizations and long COVID-like symptoms, even in children 5 to 11 years. And so, yes, in St. Kitts and Nevis, we've only experienced the Lambda variant, which to date has not impacted our children immensely. However, if perchance the Delta variant is imported and we have an outbreak caused by the Delta variant, there is potential for the Delta variant of SARS-CoV-2 adversely affecting our children, 5 to 11 years, 12 to 17 years. And so, again, we are empowering parents and guardians of children to come on board and consider consenting to this vaccine for your child or children. All right, and so this brings me to the whole issue of contact sports and the risk of spreading the COVID-19 virus. And so we have been approached by some sporting disciplines, basketball, football, with respect to resumption of the various leagues. And so we wanted just to highlight the risk of spreading COVID-19 during contact sporting activities. And so this risk is increased by the following, or because of the following. One, direct physical contact, such as tackling or checking or face-to-face contact while, playing football, basketball. Heavier breathing caused by play intensity, yelling, grunting, and spitting, which is quite common for both disciplines. Sports activities usually require persons to be together for extended periods of time, and they also put on, remove equipment, uniforms in a space, and this may be in a locker room, etc. Participation in practice games and or transportation to and fro matches. And so these are the factors or the conditions that would increase the risk of spread of the virus while involved in these contact sports. All of these will contribute to the ready spread of the virus released in the respiratory droplets of an infected player. And the risk is even higher if the event is held indoors. All right, so I know basketball in the federation and football is played outdoors, but you have the locker rooms where the players gather before going out on the court or on the field. Now, the risk of viral transmission is even higher if the players are unvaccinated. And I repeat, the risk of viral transmission is higher if the players are unvaccinated. So how can we decrease the risk of viral transmission when you are considering sporting contact sports? Physical distancing, wearing of the face mask, frequent hand sanitization, vaccination. Now, if you were to pause and think about this, when playing basketball or football, the physical distancing, the wearing of the mask, and the frequent hand sanitizing is not practical. And so when considering the risk of transmission and contact sports, it's the fourth factor that we have to depend on, vaccination. All right? The global data shows that transmission risk is higher for teams with low rates of vaccination. Or let me put it in the reverse. The risk of transmission is lower with teams with a high or 100% vaccination rate, and it follows logically. And so the National COVID-19 Task Force, based on medical guidance, we are making the following recommendations with regards to the risk reduction strategy. Okay, so what we are saying is that all players who are eligible to be vaccinated, they should be vaccinated. All coaches, supporting staff for these organized matches. No, I'm talking organized, official, competitive matches. They should be vaccinated. And then the spectators attending these organized, competitive matches should be vaccinated. Again, it's important for us to remember the COVID-19 public health and social protective measures. Accepting the vaccine, wearing your face mask at all times, maintaining adequate hand hygiene, and maintaining adequate distance from others. And if perchance you are experiencing any of the COVID-like symptoms, coughing, fever, nausea, vomiting, diarrhea, any of the COVID-like symptoms, do not go to work, do not go to school, do not take public transport. Please stay at home. Thank you.
Thank you very much, Dr. Laws. I want to recognize our co-chair of the Disaster Mitigation Council, the Honorable Wendy Phipps. We are now at the question and answer segment, and the first question has to do with those who are over 65, because you said in your presentation, Dr. Laws, that they were more at risk of death and so on. Someone is asking, when will persons over 65 be able to get their booster shots?
It's a very good question. And before I answer, I just want to clarify what's the difference between a booster shot and a third shot. Because there are some persons who can have a third shot. There are persons who are immunocompromised and who, after getting their first two doses, would not have mounted a sufficient antibody response, and so they would need to get a third shot to bring them to the level where a normal person with two shots would be. There are some persons who, 6 months after being vaccinated, their immunity starts to wane and they would require a booster shot. And what I can tell you is that the clinics are now offering booster shots to persons who qualify. They're also offering third shots to persons who qualify. And so if you're over 65 and your last vaccination was 6 months out, you can go to the clinic and get your booster shot.
Second question, this one is for you, Dr. Wilkinson. Dr. Wilkinson, we have over 2,500 recovered cases. These are persons who got infected with COVID-19 and recovered, and should therefore have natural immunity to the virus. why have you and your team not included them in the count for our threshold immunity?
Again, it's a good question, and we have not included it, and I don't think any other country around the globe have included it also. And the reason for this is, one, if somebody got infected with COVID-19 and recover, about 33% of them may have no antibody protection at all after they recover, which means that right after getting COVID-19, they can become infected again with COVID-19. Also, global studies have shown that about 65% of persons who develop antibodies after the infection, the antibody coverage starts to wane about 60 days out, which means that after 60 days, these persons again can be vulnerable. And so because of this, we don't factor that into the equation when we are speaking about the population immunity coverage. Yes, some of these persons may have some degree of protection, but because it wanes over time, it cannot be counted. We also know too that if you got COVID-19, recovered, and got vaccinated, the protection that you got is significantly higher than the protection you would have had from just natural infection. And so those are the reasons why we don't count it. And so even if you were infected and you recovered, you need to find yourself to the clinic so you can get vaccinated, so you can get the proper protection.
This next question seems to be from somebody who is eager to get back to playing sports. The government's position is that there is no mandate for the vaccination. So why are we insisting that basketball and football players be vaccinated for the season to restart? Doesn't this equate to a mandate? Also, will this be a requirement for all sports across the board?
In the CMO's presentation just now, she outlined the risk associated with viral transmission with contact sports. And yes, there is not a government mandate for vaccination, which means that we're not going to go around and pick up every Tom, Dick, and Harry and insist that they get vaccinated. But with public health crisis, we need to introduce public health measures to control the virus. And so just because there is no mandate, it doesn't mean that from a public health perspective, we cannot do things to control the virus, to prevent an overwhelming of our healthcare system. And so the measures that were spoken about as it relates to the contact sports, these are public health measures that we have to take to contain the virus. Otherwise, we will have increasing cases, we will have increasing deaths within our community. And so I don't believe that this is a mandate, it's a public health measure that we have to take.
This next question is from Vaughan Radio in Nevis. According to the November 2nd COVID-19 situation report, 12.3% of children have had at least their first dose of the COVID vaccine. Will any additional efforts be taken during the rollout campaign to encourage more parents to get their children vaccinated before the Pfizer vaccines get closer to their expiration date?
What I want you to know is that we have been actively engaging the parents with education sessions. We had sessions with all of the high schools and most of the primary schools where you have 12-year-olds, so that the parents could have been properly informed so that we can answer any questions. So these were parent-teachers meetings. We continue to educate even with these sessions, and we ask everyone to come on board with the all of society approach to try and encourage persons to come forward and get vaccinated. So I want to ask Van Really also to get on board and try to encourage persons to come along. We've said over and over again that we don't have a monopoly on information. We don't have a monopoly on the education session. Anybody can be a messenger in this fight. Some persons might listen to me, some persons might listen to Dr. Laws, some might listen to Cromwell, other persons will follow the advice from the Mansion Bull. And so anybody can be an advocate for this vaccine program. And so what I want to tell the public out there, that we all need to come forward and make sure that these persons get vaccinated. And if we have 77% of adults with at least one shot, I am pretty certain that these 77% of adults who went forward to get vaccinated to protect themselves, most of them will be the parents and guardians of the 12 to 17-year-olds. And so if you did something to protect yourself, you should also make sure that you do the right thing to protect your children by getting them to come forward and get vaccinated. So I'm hoping that over the next week or two, we will see our numbers continue to climb as we try to encourage persons to come forward to take a vaccine that we know is safe and effective and will protect them from severe disease and death.
Now, someone is eager for their children, I think, 5 to 11-year-olds, to get vaccinated. So they want to know, following on what you said, Dr. Laws, that the CDC has approved the Pfizer vaccine for children 5 to 11-year-old. When will we start administering it in this age group?
That's a very good question, Mr. Williams. And so, as I said before, the US FDA and the CDC has approved its use, emergency use authorization for use in children 5 to 11. So in the Caribbean region, Caribbean or CARICOM member states, we are awaiting that nod of approval from the World Health Organization and the Caribbean regulatory system, CARFA, in terms of, telling us, yes, we can begin. So once we get that nod of approval, it will be offered in that age range in the Federation of St. Kitts and Nevis.
And this is our last question for today. Is it likely that the 24-hour quarantine will be lifted before the Christmas season?
I said in my opening remarks that anyone who wants us to get back to normalcy need to make sure that they come forward and get vaccinated. And normalcy also includes lifting of any quarantine period. And so the more persons who come forward and get vaccinated is the more normalcy we will have.
And just one more, Dr. Wilkinson. That one was the penultimate one. Someone wants to know why, when they take a PCR test 3 days before travel, coming into the Federation, when they land here, they still have to have another test taken before they're out of quarantine. What is the science behind it?
Okay, so it's all about risk and how much risk we are willing to absorb. And if we were to just go based on science, and if we were looking for zero COVID in St. Kitts, we will still have our borders completely closed and we would be COVID-free. But we have moved from having the borders closed to opening the borders to having a 14-day quarantine, a 9-day, 4-day, and now 24 hours. And with every reduction in the quarantine period is the more risk we will absorb with the importation of the virus. But as our vaccination coverage increase, there are less persons who are vulnerable to the virus. And so that's one of the reasons why we can make those decisions. When somebody is coming into the Federation, we need to make sure that they are coming in with a great chance of them being negative. And so that is one of the reasons why you have to have a negative PCR test before you enter. In coming to the Federation, however, you have to be in close contact with persons on the airport, on the airplane, etc. And there is a chance that you can pick up the virus en route, because a negative test is just as good as the time when it was taken. And so when you're placed into quarantine and you have to have a test to release, we also want to make sure that we are checking to see whether or not you picked up the virus on the way in. The CMO is going to add to what I'm saying.
That's a very good question, Mr. Williams, and I just wanted to add objective evidence why it's important. I just got a message saying that we have now three of the cases we recently added were 3 imported cases, meaning they're fully vaccinated and they would have presented their negative RT-PCR test done within 72 hours of travel to the Federation. They would have come in, go into quarantine, and that test within the 24 hours, that test came back positive for 3 individuals, and so they are being monitored for until recovery. And so, you can contract the virus along the corridor of travel. Okay?
Well, thank you so much for those answers to the questions, and that brings us to the end of that segment. I thank Dr. Cameron Wilkinson, our Medical Chief of Staff, our Chief Medical Officer, Dr. Hazel Laws, and Superintendent of Police, Mr. Cromwell Williams, for their presentations today. I keep saying Cromwell Williams. Superintendent Cromwell Henry. Cromwell Williams used to be my classmate. I thank the media houses. In particular, I thank ZIZ for their dedication in bringing these briefings to the public, live, both on radio and television and Facebook and YouTube. We thank them very much. To all the other media houses in the Federation that continue to partner with us in this fight against the COVID-19 pandemic, we say thank you very much. I say thank you to the SKNIS staff that they have given extremely good coverage, excellent coverage to this COVID-19 management. There are a number of press releases that they have written since the start of these briefings, and I want to commend them. I want to thank the Honorable Wendy Phipps for her support here always at our NEOC briefings. Ms. Michelle Rodriguez, who is the new PRO at NEMA, who continues to work behind the scene, and of course, Dr. Marissa Carty. She's going like the Energizer Bunny. She works extremely hard. And to all of you for joining us and for continuing to pay attention to what is happening and for playing your part in the management of the COVID-19 pandemic here in St. Kitts and Nevis. Thank you very much. We'll see you next week. I am Les Roy Williams.